this is Rick Kaselj from exercisesforinjuries.com. So I wanted to go through the 7-question quiz on SI joint recovery. Now, if you don't know who I am, I'm an injury expert, and what that means is I help people overcome injury and pain with exercise. My background is I've done my bachelor's degree in kinesiology with a focus on active health, which is injury recovery, and I've done that since 97, and I've been working with people with injuries since 1994. In 2008, I went back to school and got my master's degree focusing in on effective exercises for the rotator cuff. I've worked in all kinds of settings when it comes to working with people with injuries, so physical therapy clinic, personal training studio, gym, rehab center, all over the place. And then now what I end up doing is I see clients, but also I do courses for health and fitness professionals, webinars, videos, and presentations, and write books and manuals on the topic of exercises and injuries. Now, if you want to go to my hub and see what I'm doing right now, if you head on over to exercisesforinjuries.com, you can see interviews and blog posts and videos when it relates to exercise and injuries. Now let's get into the first question. Where can SI joint pain refer to? So we've got lumbar region, so lower back, growing, private parts area, abdomen, so the stomach, or all of the above. So the answer ends up being D. So all of the above. So people report that it starts in the SI joint region, so the gluteal region, and then refers into the lower and upper lumbar region, growing abdomen and or lower limb. So it can refer to other areas, SI joint, injury, and pain. You can end up having referred pain in other areas of the body, as opposed to just in that SI joint, sacroiliac joint area. Now, number 2, what percentage of people with mechanical low back pain is due to SI joint pain? So we end up having like less than 10%, between 11 and 20%, between 21 and 30%, between 31 and 40%. So mechanical low back pain is the regular low back pain that people end up having. They might end up seeing their doctor and given the label of mechanical low back pain, but it's the most common kind of back pain. So the answer ends up being C. So C ends up being the answer. So how big of a problem is SI joint pain? It accounts for 16 to 30% of chronic mechanical low back pain. And this is the reference where I got it from. So the journal article that actually gave me those numbers. Difficult to differentiate from other forms of low back pain. So SI joint injury and pain. SI joint has been shown to be a source of pain in 10 to 27% of suspected cases of chronic low back pain. And this is Hansen, another article. So you can see, regular back pain, a good percentage of it is due to this SI joint pain. So it can be from 10% all the way to 30% of regular low back pain can be due to SI joint pain. Now moving on to question number 3, if SI joint pain is not a low back injury, what kind of injury is it? Pelvis, hip, knee, none of the above. It ends up being A. It ends up being a pelvis injury. So it ends up being right here, sacrum, ilium, part of the pelvis. So it ends up being more of a pelvis injury. The sacrum is technically part of the spine, but I look at more low back pain and low back injuries relating to specifically of the spine. And the SI joint I kind of pull out, and it ends up being more of a pelvis injury or pelvis pain. Now, number 4, how much movement is there in the sacroiliac joint, the SI joint? Lots, some, a little bit, none. So the answer ends up being C. Ends up being C. And so you can see the SI joint here is protected with all kinds of ligaments to add stability to that SI joint area. We end up having that ilium, and then how that ilium hooks up to that sacrum, just the way they're structured, ends up allowing for lots of stability. But looking at how much movement there is, 3 degrees of rotation in that SI joint, 2 millimeters of translation in 3 dimensions, like forward, back, up, down, side to side. So it ends up being a very slight movement, so a little bit of movement. Now, looking at number 5, at what age does the SI joint begin to stiffen up? 60s to 80s, 40s to 60s, 20s to 40s, or at puberty? It ends up being A. It ends up being 60s to 80s. Age-related changes start in puberty and continue. They accelerate during the 30s and 40s, and then things end up stiffening up in the 60s and then locking up in the 80s when it comes to that SI joint pain. So it's kind of, in order to remember that, it'll give you a better understanding of the injury, and maybe a better understanding for you, depending on what age you're at, on what's going on in your SI joint or pelvis. Now, looking at the next question, so number 6, if you have an SI joint injury, which exercises could be harmful? Like, be harmful for you to do? Is it leg press, single leg squats, running, or all of the above? It ends up being all of the above, so it ends up being D. It means you want to be cautious of single leg work, like leg press, single leg squats, running, jumping, and you want to watch the pelvis during the leg press, crunches, core work, and hip extension. So you want to be very cautious of, all these exercises if you end up having an SI joint injury or SI joint pain, because you might be doing these exercises and thinking that they're helping you, but they could end up being irritating and leading to more pain. Now, number 7, what has been shown to help overcome SI joint pain? Decrease your sitting, doing a hot tub prior to activity, addressing muscle imbalances, or all of the above? Number C, addressing muscle imbalances. So addressing muscle imbalances, the onset of oblique internus abdominis and multifidus occurred before initiation of weight transfer in the controlled subjects. The onset of oblique internus abdominis multifidus glute maximus was delayed on the symptomatic side in subjects with SI joint pain compared with control subjects, and the onset of biceps femoris electromyographic activity was earlier. So meaning, if we end up looking at people with SI joint pain, they have different types of firing patterns going on in their muscles. So these core muscles that I was mentioned here in these big words, they end up being delayed. Delayed, so turning on. They end up being slowed down when it comes to turning on, and those muscles turning on provide stability and support in that SI joint. So we need to address that. We need to address that activation, the endurance of those muscles, and the strength of those muscles in order to help with that SI joint and SI joint pain. So really try to remember that. Now, just before that ends up being the last question, but before I end up wrapping up, head on over to exercisesforinjuries.com. I have a whole bunch of injury workouts for all kinds of injuries, and come out with maybe 1 a month, 1 to 2 a month. So I've done injury workouts for tennis elbow, jumper's knee, Achilles tendonitis, lumbar fusion, plantar fasciitis, IT band syndrome, shin splints, piriformis syndrome, patellofemoral pain syndrome, meniscus tear, SI joint pain. and low back pain. So head on over to exercisesforinjuries.com, and if you have a different type of pain or injury, or your clients do, or your colleagues or friends, you can refer them on over there. I have an injury workout that'll help them overcome their injury and pain. Now, if you have SI joint pain, or clients that have it, or colleagues, friends, and family, you can end up heading on over to here to sacroiliac.com/second edition. I just released the second edition of the Sacroiliac Pain Solution, and I've kind of updated it with new videos. So a new video presentation where I go into the essentials that you need to know about your SI joint pain. Follow along videos when it comes to the exercises that I end up recommending, and I've tweaked the program and updated the manual. Now, make sure you swing on by exercisesforinjuries.com. I have other stuff, like free stuff when it relates to your shoulder, that'll end up helping you. Make sure to, if you have any questions, send them on over to support@exercisesforinjuries.com, and make sure to visit exercisesforinjuries.com. So there you go. That ends up being the 7-question quiz on SI joint recovery. So this is Rick Kaselj from exercisesforinjuries.com saying take care and bye-bye.